All right, let's talk about something you might have noticed, but maybe felt a little weird asking about. What's the deal with foamy urine? We're going to break down what it is, what it could mean, and most importantly, when it's a signal from your body that you really shouldn't ignore. So, you've probably seen it, right? You go to the bathroom and there's foam or bubbles, and you kind of wonder, huh, is that normal? Well, you are definitely not alone in asking that, and today we're going to get to the bottom of it. Okay, so the good news right off the bat is that most of the time, foamy urine is totally harmless. It's no big deal. So before we jump into the more serious stuff, let's cover the simple, everyday reasons you might be seeing some bubbles. A lot of the time, the explanation is super simple. For instance, if you have a really forceful stream, well, that can just whip air into the water, creating foam that disappears pretty quickly. It's kind of like turning on a faucet full blast. Or maybe you're just a little dehydrated. When that happens, your urine gets more concentrated, and that can cause some bubbles too. Both of these are super easy fixes. One, you just wait a second, and the other, you just grab a glass of water. Okay, so we've covered the harmless causes. But what happens when that foam sticks around? It doesn't just disappear. This is when we need to start paying a little closer attention, because persistent foam can actually be a warning sign, and it often points to one specific thing: too much protein in your urine. And there's a medical term for this. It's called proteinuria. That's just the fancy name for having excess protein in your urine. It is the #1 culprit behind foam that just won't go away. So when doctors see persistent foam, their first thought is often, okay, let's look into proteinuria. So how does all that extra protein even get there in the first place? Well, think of your kidneys as these amazing high-tech filters for your blood. When they're healthy, they're fantastic at their job. They keep all the good stuff, like essential proteins, inside your body where they belong. But if those kidney filters get damaged, they can get a little leaky. And when that happens, protein can escape, spill into your urine, and that's what creates that stubborn, persistent foam. And this leads us to what proteinuria can actually signal. It's really important to know that it isn't a disease itself. It's more like a symptom, a clue. It can point to things like chronic kidney disease or even inflammation in the kidney's tiny filters, a condition called glomerulonephritis. The big takeaway here is that seeing that protein consistently is a clear sign that something needs a closer look. All right, so we've established that foamy urine can be a sign of a problem, but how do you know for sure? Let's get really clear on the specific signs that mean, okay, it's time to make a call and get this checked out. First things first, just look at the foam itself. Ask yourself a few questions. Has this been happening for more than a few days in a row? Does it look kind of thick? And does it stick around in the toilet bowl for a long time even after you flush? If you're nodding yes to these, that's a clue that it's probably more than just a temporary thing. Now, foamy urine is one signal, but it's pretty rare for it to be the only one if something is really up. You've got to watch for other symptoms that might be happening at the same time. Things like swelling, especially in your face, hands, or feet. Or maybe you're feeling unusually tired or nauseous. If you're seeing foam plus any of these other symptoms, your body is basically shouting that something is wrong. Definitely don't ignore that combination. And this is absolutely crucial for certain groups of people. If you have conditions like diabetes or high blood pressure, or if kidney disease runs in your family, you need to be extra vigilant. Why? Well, think about high blood pressure. It puts a ton of extra strain on those delicate filters in your kidneys day in and day out. So for you, foamy urine isn't just a random thing to notice. It's a symptom that really needs to be monitored closely. Okay, so you've decided to see a doctor. That's a fantastic first step. I know it can feel a little nerve-wracking, so let's pull back the curtain and demystify what's actually going to happen. The whole diagnostic process is usually pretty straightforward. So your visit will probably start with a really simple urine dipstick test. It's quick and it can spot protein right away. If that test comes back positive, your doctor might ask for a 24-hour urine collection. It sounds like a hassle, but it gives them a much more detailed picture. And from there, they might do some blood tests to get a full assessment of how well your kidneys are functioning. See, it's just a logical, step-by-step process to get you clear answers. And why is all this so important? Because when it comes to your kidneys, catching a problem early is everything. Seriously, early detection means you can manage whatever is going on, prevent any further damage, and just dramatically improve your health for the long run. Acting on these early signs is honestly the most powerful thing you can do for yourself. So, what's the bottom line here? It's best to think of foamy urine not as the problem itself, but as an initial indicator. It's like a little warning flare sent up by your body. Most of the time, it's nothing to worry about. But sometimes it's signaling a real issue that needs your attention. And that really leaves us with a final thought. Foamy urine is just one of the countless signals your body sends you every single day. The real question is, are you listening? Paying attention to these little clues is the first and maybe the most important step you can take